Paranoid personality disorder (PPD). It's a mental illness. Look at this picture, shows that suspicion and mistrust emotions, experience anxiety and depression, detail going on. Introduction. Paranoid personality disorder is a chronic mental health condition characterized by perceived distrust and suspicion of others, leading to significant social and interpersonal difficulties. Individuals with PPD are often preoccupied with doubts about the loyalty or trustworthiness of others, leading to them to misinterpret, begin actions or commands as malicious. Definition. Paranoid personality disorder is defined as a personality disorder in which a person exhibits long-standing patterns of mistrust and suspicion towards others without sufficient basis. This pervasive distrust and suspicion begin in early adulthood and manifest in various contexts. Types. While PPD itself is a single diagnostic category, paranoia can manifest in various forms, often categorized based on the severity and context. First, mild paranoia, general mistrust or suspicion in specific situations. Second, severe paranoia, perceived distrust affecting all aspects of life. 3. Delusional paranoia, paranoid belief that are rigid and fixed, often seen in more severe mental health conditions like schizophrenia. Causes. The exact cause of PPD is unknown, but it is believed to result from combination of genetic, environmental and psychological factors. One genetic factor, a family history of personality disorders or other mental illness may increase the risk. 2. Environmental factors, childhood trauma, abuse, neglect can contribute to the development of PPD. 3. Psychological factors, early life experiences that contribute to worldview demonstrated by distrust and suspicion. Risk factors. Several factors may increase the risk of developing PPD. 1. Family history, a history of schizophrenia, delusional disorders, or other personality disorders in close relatives. 2. Childhood trauma, experiences of neglect, emotional abuse, or psychological abuse during childhood. 3. Chronic stress. Ongoing stress or anxiety in daily life may exacerbate paranoid tendencies. Complications. PPD can lead to various complications including 1. Interpersonal difficulties, strained relationship with family, friends and colleagues. 2. Social isolation, withdrawal from social situation due to distrust. 3. Impaired functioning, difficulty maintaining employment or functioning in daily life. 4. Comorbid conditions, increased risk of depression, anxiety disorders and substance abuse. Dysfunction in neurotransmitters such as dopamine and serotonin may also play a role. Additionally, hyperactivation of the amygdala, which processes fear and threat, could contribute to the heightened state of alertness and suspicion seen in PPD. Pathophysiology of paranoid personality disorder PPD, step by step. First step, genetic predisposition. 2. Early life experiences. 3. Hyperactivation of the amygdala. 4. Dysregulation of the peripheral cortex. 5. Abnormalities in neurotransmitter systems. 6. Cognitive distractions. 7. Perpetuation of paranoid beliefs. 8. Impact on social and occupational functioning. 9. Chronicity and complications. Signs and symptoms. Key signs and symptoms of PPD include 1. Pervasive distrust, consistent suspicion that others are deceiving or plotting against them. 2. Reluctance to confide, hesitancy to share personal information due to fear of betrayal. 3. Hypersensitivity to criticism, overreaction to perceived slights or insult. 4. Unfounded jealousy, irrational suspicion regarding the fidelity of a partner. 5. Interpretation of benign actions as hostile, misinterpretation of neutral or friendly gestures as malicious. Diagnosis. Diagnosis of PPD involves a comprehensive assessment by a mental health professionals including 1. Clinical interview, in-depth discussion of symptoms, history and behavior patterns. 2. Mental status examination, evaluation of thought process, perception, and cognitive function. 3. Diagnostic criteria, meeting criteria outlined in the DSM-5 Diagnostic and Systematical Manual of Mental Disorders, 5th edition. 4. Exclusion of other conditions, ruling out other mental health disorders such as schizophrenia or delusional disorder. Nursing diagnosis. Common nursing diagnosis for patients with PPD may include 1. Impaired social interactions related to perceived distrust and suspicion of others. 2. Anxiety related to constant fear of harm. 3. Ineffective coping related to maladaptive responses to stress or perceived threats. 4. Risk for violence directed towards others due to mistrust and suspicion. Management. Managing PPD involves a multi-factored approach. 1. Therapeutic relationship, building trust with the patient, which is essential for effective care. 2. Cognitive behavioral therapy, CBT, focus on challenging and changing distorted thought patterns. 3. Supportive therapy, provide emotional support and helps the patients develop coping strategies. 4. Medication. Antidepressants or antipsychotics may be prescribed to manage symptoms of anxiety, depression, or paranoia. 5. Education. Teaching the patients about the disorder, promoting insight, and encouraging compliance with treatment. Treatment methods. Treatment options for PPD may include 1. Psychotherapy. The primary treatment focusing on addressing paranoid thoughts and improving social functioning. 2. Medications. While no medications are specifically approved for PPD, antipsychotics or antidepressants may be used to treat associated symptoms. 3. Group therapy can help patients learn social skills and reduce fears and feeling of isolation. 5. Family therapy helps family members understand the disorders and improve their interactions with patients. Psychosocial medicine. Psychosocial interventions are critical in PPD management. 1. Social support networks, encouraging participation in community activities and support groups. 2. Vocational rehabilitation, assisting with job placement and workplace accommodations. 2. Crisis interventions, provide support during acute episodes of distress or paranoia. Prevention. While PPD cannot be entirely prevented, early interventions and addressing risk factors may induce the likelihood of developing the disorder. One, early treatment, addressing childhood trauma and providing mental health support early in life. Two, stress management, teaching coping skills to manage stress and anxiety effectively. 3, education and awareness, promoting understanding of personality disorders and encouraging early mental health consultations. In conclusion, paranoid personality disorder is a complex mental health condition that poses significant challenges for both the individual and those around them. Early diagnosis, effective management, and comprehensive treatment strategies are essential for improving the quality of life for individuals with PPD. Through a combination of psychotherapy, medication, and social support, patients can learn to manage their symptoms and lead more fulfilling lives. Thank you. Have a nice day.